another thing which helps the patient and the family gain confidence in their doctor is when the doctor says, I'm sorry, I don't know what's wrong with you, but I feel that Dr. X, who has much more experience in this particular aspect of your disease than I have, may be able to help, and I would like to request the help of that doctor. Would you agree? If you permit me to do that, I will call that person. So that gives them added confidence that, okay, you feel that you don't know enough, but there is somebody who may be knowing more than you, at least as regards this particular aspect of the disease, and you are honest enough to say that I will request that doctor's help if you permit me. And 9 times out of 10, they will say, yes, please call that doctor. It is not seen as your, splitting fees with that. I mean, that's not the intention, and they don't perceive that as the intention either, because they are aware of what you have been doing for that patient. They are also aware that you're puzzled, you're anxious, you're tense, you're worried, and you are now seeking a second opinion from somebody whom you feel is better than you in this particular regard.
Very important. I think I can't agree with you more. But let me tell you what happens sometimes in practice, particularly in patients who are very critically ill. The patient has a lot of things wrong with him. So you have a patient looking after it, you have a consultant looking after his heart, you have a consultant looking after his lungs, you can have a consultant who is looking after his GI tract, one consultant who looks after his blood, one person is looking after his kidneys, and you have 7 or 8 people looking after the same patient, and proverbially too many cooks spoil the broth. But therefore, what Dr. Pandya says is absolutely correct. When you don't know what is happening, and when you feel that somebody in this particular field is more knowledgeable than you, or more experienced, not necessarily knowledgeable, because I think the younger chaps who pass out now are even more knowledgeable than all of us perhaps put together, but say more experienced than you, has seen more of this sort of work. I think it's your, not only, it's your duty as a matter of fact to say, I would like somebody else's opinion in this particular field, yet not carry it to the point where there are 10 people looking after the patient. And believe me that nobody knows what's happening to the patient. So when such a situation does arise, for example, a patient who's critically ill needs to be dialyzed, alright, so you need to have a person who is dialyzed. He needs to be bronchoscoped, there are bowel studies done. You will need a chap who is good at this, very good at this, in a person who is really very ill to do that also. You might have, but there must be an individual who really takes overall command of the situation and gives the right perspective and knows what is more important at an immediate point in time and what can be left to burn on the back.